The Food and Drug Administration is officially easing restrictions that'll allow more gay and bisexual men to donate blood. The federal agency says it'll now recommend an individual risk-based survey for all donors, regardless of their sexual orientation. It ends a policy that began in the 1980s designed to protect the blood supply from HIV by fully banning men who have sex with other men from donating. Critics have long said the guidelines were discriminatory. The rule was updated twice during the last several years, but still included limits, requiring those individuals to abstain from sexual contact for certain periods of time before giving blood. For more context, I'm joined by Dr. N Halkitis, Dean of the Rutgers School of Public Health, who spent decades researching HIV and the AIDS epidemic. This is a long-awaited announcement. What does this mean as a whole, both for the community, LGBTQ, and just for the need for blood, which we've seen a shortage as of late?
So, Brianna, I think first and foremost, we know there's a blood shortage in the United States, right? So we should be able to get blood from any person who's able to give blood. And so this change in policy, or this recommendation for this change in policy, is welcomed in that regard. But here's what it means also for like gay men and bisexual men. For like 40 years, gay and bisexual men have been prevented from donating blood in any meaningful way. It has created a level of stigma and discrimination for a community that, quite frankly, has done a really good job at managing HIV. Now, what it also does is it makes blood donation about behavior and not about a person's characteristics. So can you imagine if we had a policy in the United States that said, oh, you cannot donate blood because you're Asian. Oh, you cannot donate blood because you're a woman. We would not tolerate that. But what this new policy does is, look, if you're a person who's potentially at risk sexually because you've had multiple partners, or you have a new partner and you don't know that person's status, and by partner I mean sexual partners, then we have to reconsider you for blood donation. And that doesn't matter if you're gay, bi, straight, queer. Any of those identities make no difference. It's about behavior. So that is an advancement that aligns perfectly with science.
Well, and it's interesting, right? Because for years, the American Medical Association has said that this limit on the donors wasn't necessary, that proper screening exists. Of course, it was put in place back in the early days of the AIDS epidemic. And yet the FDA was slow to make this new recommendation. Why was that? Was it discriminatory, as you're saying?
Well, I think, the result of that, the timing, the slowness, the sluggishness of the FDA is just an indication of historic artifact around the HIV epidemic. And for those of us who are old enough to remember, this disease, AIDS, was called GRID at first, gay-related immune deficiency. Right. And so over the course of the last 40 years, that stigma, that name, that blame hasn't really gone away. So the FDA realizes the political environment that it's in. It realizes that there's a generation of people who still think about AIDS as a gay disease, and it had to be really thoughtful in rolling this out. So while I have, I wish it was faster, I do have some compassion for the FDA and the political forces they have to face in order to be able to make these decisions.
All right, Dr. N Halkitis for us. Thank you so much for joining me.
Always an honor to be with you, Bree.
Support